Welcome to the Dispense Magazine podcast with news and information about medical cannabis. We talk about the things you and your doctor might talk about. I'm your host, Sven Hosford. In this episode, it's Cannabis Conversations at Solevo Wellness. This is part one of a discussion on medical marijuana for pediatrics. Today, we hear from Dr. Kultar Shergill, who is a board-certified pediatrician who practices in the Alekiski area, and Dr. Elizabeth Spaar, who's been treating autism and PTSD even before the dispensaries opened in Pennsylvania through her participation in the Safe Harbor program. Now let's head over to Solevo Wellness, recorded live on October 20th, 2018. Welcome, everybody. My name is Sven Hosford. We are here at Solevo Wellness in Pittsburgh for another episode of the Dispense Magazine podcast, which the ones we record here we call Cannabis Conversations. And we like to bring together a group of medical professionals and some of the staff here from Solevo Wellness. And I've really enjoyed the first two that we've done here. This is our third one, and I really think we're going to have a great conversation here today. So thank you all for coming. The topic is cannabis and pediatrics, which is, I think, just a great topic. Let me do a quick introduction of our panel. We have Dr. Elizabeth Spaar. She is a Pennsylvania medical marijuana certified physician, and as a physician treating autism and PTSD, Dr. Spaar has seen amazing results with medical cannabis or medical marijuana, even before the dispensaries opened in Pennsylvania through her participation in the Safe Harbor program. Two of her own children currently take medical marijuana for their autism and have benefited greatly. She's passionate about providing access to this crucial medicine and to all the patients with qualifying conditions. So thanks for being here, Dr. Spaar.
Thank you.
Dr. Kultar Shergill, did I say that right?
That's correct.
Kultar Shergill is a board-certified pediatrician who trained in London, England. I could tell that from your accent. He has been serving the Alekiski area, a little bit different than London, I would say, for 18 years, as well as general pediatrics. He treats children for behavioral issues, ADHD, autism, epilepsy, and asthma. And Dr. Shergill is also a certified Pennsylvania medical marijuana physician. So thank you for that.
Thank you.
Annie Corbin is the Solevo Wellness Director of Pediatric Care and a patient care consultant. Annie works closely with patients to help them select the best medical marijuana strains and ratios based upon their physician's recommendations and their unique situations. That's really a valuable service. Annie has worked hands-on with both plants and patients. Is that right? Plants and patients. As a grower. Okay, sorry. In Colorado as a grower and a patient consultant. Annie suffers from epilepsy and also assists her daughter, who has a rare brain condition and epilepsy, to help her have the best quality of life through the administration of this medicine. And we have the only guy taller than me in the room, Richard Greer. Not Gear, don't get excited. Richard Greer is a licensed pharmacist. He is the licensed pharmacist here at Solevo. We're head of pharmacy, right? What's your title?
Pharmacy Director.
Pharmacy Director. Well, that makes more sense. He completed his Director of Pharmacy degree at Duquesne, and while in pharmacy school, he served as class president for 4 years, sat on numerous student advisory committees, and was a member of the prestigious Kappa Psi pharmaceutical fraternity. Also received his bachelor's degree in business administration from Duquesne, where he graduated on the dean's list. He is licensed through the Pennsylvania Department of State to practice pharmacy and is a certified medical marijuana practitioner through the Pennsylvania Department of Health. So welcome, everybody. Thank you for being here.
Thank you.
So, Dr. Shergill, we're gonna start with you. Let's talk about the three conditions, the qualifying conditions that the state has dictated that would right away come to the attention of pediatricians would be epilepsy, autism, and irritable bowel syndrome. Can you describe how much of your practice is involved with any one of those three?
Sure, Sven, thank you. First, I just want to start by thanking Sven for organizing this educational program. It's great that people are spending time providing education for both for physicians and for the general public also. So I'm a pediatrician. I have a medium-sized solo pediatric practice in New Kensington, and I see many kids with all of these conditions in my practice. So the first one you mentioned was epilepsy. So epilepsy in the States, roughly 3.4 million people in the US suffer from epilepsy. That accounts for about 1% of the population. In my practice, I have about 20 kids with seizure disorder, and the parents of most of these kids are asking very, very good questions about how medical marijuana can help my kids, how it can help them wean off medicines, how maybe even have less of the seizures.
So you're seeing very good reception of cannabis among those
Absolutely,
parents.
because the medicines that are out there are not as effective as they could be, and they have side effects. So they say for children who are on anti-epileptic drugs, roughly 30% still continue to have breakthrough seizures. Even when they're put on multiple anti-epileptic drugs, that number still stays around 30%. So a good proportion of those still continue to have seizures. And then the kids on multiple anti-epileptic drugs, so they're also have bad side effects. So I'll just talk about autism also. Roughly in the States, the incidence of autism in kids is roughly 1 in 59, or about 1.7%, and it still is continuing to increase. The last numbers were from 2016. It was 1.5%. We don't know if this is a real increase or it's only just because physicians are looking more for the condition and kids are being evaluated more. The other condition you mentioned, inflammatory bowel disease, this is more like an umbrella condition for both, encompasses ulcerative colitis and Crohn's disease. And so these are usually diagnosed late in adolescence or early adulthood, but still the prevalence in kids is about 0.5%. So most pediatricians like myself do have several kids with inflammatory bowel diseases in our practices. So just talk a little bit about the medical treatment of these conditions.
Right, that was my next question.
Oh, okay. You're going to go ahead. Okay.
But actually, before we get to that, I wanted to ask, it's interesting to me that you have one medicine that can treat these three very different kinds of conditions. Do we know enough about what causes these conditions to know if there's anything that ties the three of these things together from a causal standpoint, from a root standpoint? Do we know what causes epilepsy or autism?
We don't know exactly the causes. We do research with medications, and they help, and we use them. But the underlying causes, we don't know what causes all three of these, especially autism. There's very little idea of what causes.
But isn't it interesting that you have the three very different kinds of conditions that can all be treated? And I'm just wondering if there's been any notice of that or tying in what the causes is or so forth.
There's been very little research on that, and really there's not much that
we don't know what
about.
Causes it then.
We do not.
But let's get into where you were talking about. Let's talk about what kind of medical treatments do we have? What are their limitations and what are their side effects?
So in my pediatric practice, probably the commonest condition that I get asked about medical marijuana, how it can help, is epilepsy or seizure disorder. So again, I said before, about 30% of kids on anti-epileptics still persist to have seizures, even despite being put on multiple anti-epileptic drugs. And then the side effects of these, they have a very wide variation of them. There can be physical side effects, there can be cognitive side effects, can be behavioral problems. Of those 30% that still persist to have seizures, they become socially isolated, they have behavioral problems, it can lead to dependence problems with these children also. The older established drugs for seizure disorders like valproate, phenytoin, and carbamazepine, so these are all used much less, primarily because of those reasons of their side effects were too great. And some of the newer ones, lamotrigine or Lamictal, has side effects, can cause bad skin rashes. Neurontin can cause psychosis and insomnia, and Topamax causes psychosis also, and cognitive side effects. So really the medical treatments available for epilepsy are still limited, and there's plenty of room for other drugs to be evaluated. Autism is kind of an umbrella term for treatment for conditions of communication, behavior, and there's social aspects to that too. And there's only very few drugs that are FDA approved for autism. One is Risperidol. It's an atypical antipsychotic, and there's Abilify. So that has severe side effects with weight gain, blurred vision, and insomnia. So again, even for autism, the treatment is lacking quite a bit. The way we treat inflammatory bowel diseases over the last 10 years has improved a lot. Our traditional medicines are steroids, salicylates, antibiotics, and immune modulators. And then over the last 10 years, there's a new group of biological therapies researched through like genetic engineering, and the commonest one is anti-tumor necrosis factor. But even with all 6 of those, studies still show that up to 1/3 of patients with inflammatory bowel diseases still persist to have flare-ups of their disease despite being put on these strong medications. And then also about 40% of kids who are on these medications aren't compliant with them. So it's still a condition that requires, there's a significant need for more treatments and more research to be done on these. So there's still lacking a lot of treatments.
So you said something like 30% of people with epilepsy still have seizures.
Correct.
A third of the IBS still have flare-ups
even on treatment,
even after with medication. So, and then it's interesting about the compliance. I'm just going to guess, and we'll get to maybe Annie has the answer to this, but I'm going to guess that compliance is a little bit higher with medical cannabis. Is that true?
Yes.
Okay. Well, let me ask you one more thing, Dr. Shergill. What got you interested in medical cannabis? How did you first get turned on? What tipped what got you over the top to say, okay, I'm going to go ahead and get certified?
So really, it was just kind of learning about how the marijuana has very good legitimate benefits for these conditions. It's as simple as that. It's not that I had one fantastic response, but it's just learning about all the conditions that it can help with.
Sure. Anybody in the audience have any questions for Dr. Shergill? Okay. We do have a question. Okay, go ahead.
The question from the audience member was about the effectiveness of medical marijuana on the 30% of children who did not respond to any seizure medicine, and whether we are finding medical marijuana to be the solution to what pharmaceuticals are lacking.
Thank you. That's a great question. So really, marijuana has been shown to decrease the length of seizures. Definitely, there's many studies that show the length of seizures. Kids under 2 years of age who are having seizures, 15 to 20 of them per day, it decreases the length of each of these seizures from 10 minutes to 1 to 2 minutes, and it has been shown to decrease the number of seizures as well. But definitely there are large studies from Europe as well that have shown the length of the seizures has decreased on medical marijuana.
His follow-up question was for parents dealing with a new diagnosis. Is the doctor frontlining medical marijuana? What's the treatment approach for someone trying to figure out what the best option is?
Absolutely. So that's a great question too. So at present, there aren't any good guidelines, even from the American Academy of Pediatrics, American Academy of Neurology. There's no good guidelines out there that tell us how to treat a seizure disorder. So we're looking for more research to be done. We've only just got this approved this year, so it's an ongoing research effort.
Okay. So let's move on to our next panelist. I know it was quite a chore for you to get here with the traffic this morning, so I do appreciate you showing up. Dr. Spaar, before we get into talking about different conditions and things, I think one of the reasons people will tune into this podcast is to find out about the safety issues. Do you find that that's the thing people are most concerned about?
It's definitely one of the big concerns, and it's definitely a concern amongst physicians who are still trying to make up their mind about this. And the issue is that we don't have as much research as we'd like, has to do with pretty much all areas of medical marijuana right now. And one of the things I wanted to talk about is that the research that we do have on the effects of marijuana on adolescents that's been done, some people will use that to argue that there are negative long-term effects because there was some research showing a decline in cognitive function and an increase in the rate of psychosis. And you may, if you're a parent and you end up putting your child in medical marijuana, you might have people bringing this up with you. And so I wanted to clear up the fact that with those studies, number one, there was no proof that the marijuana actually caused the issues. It was simply a correlation, if you will. So they followed groups of teenagers who were heavy recreational users, and they compared to the groups of teenagers who weren't using marijuana. And there was no way to know if the marijuana had caused it or if that a group of teenagers who were predisposed to those issues were more likely to use marijuana. And the second thing with those studies is that they were recreational users, so they were using larger amounts than most kids on medical marijuana would ever use. They were smoking it, which is not the way that children and adolescents on medical marijuana would use it. And we don't know the quality of it, and we don't know what other substances might have been in it. And I see physicians pointing to those studies and trying to say that this is definitely going to have a negative effect on kids. But those studies definitely didn't prove that. We don't have any studies showing that there are going to be long-term negative effects with it.
Are there studies that show that there are no long-term effects?
I wish that there were. No, we do not have those kind of studies yet. And there's certain research ethical issues that are going to restrain us from doing probably the level of research we'd like to.
Well, I know that parents probably ask questions like, "Well, will my child get high?"
Mm-hmm.
You know, or do you address the long-term issues and probably issues like, you know, can I get in trouble with the police and have children youth services show up on my doorstep and that sort of thing? Right.
Yeah. So first of all, no, your child does not need to get high to have the benefits of medical marijuana. My kids, my two sons who are on it, are definitely much more clear-headed than they were before, so they're quite the opposite of being stoned. And like I said, they're not going to be smoking it. That's not one of the methods that we deliver in Pennsylvania. There's also a lot of fear out there about stigma and about judgment, and could I even get in trouble with CYS or with the law? And maybe parents have seen news stories in other states where it isn't legal, where parents have gotten in trouble. In Pennsylvania, you're absolutely not going to get in trouble with the law with CYS. If your child is certified for a qualifying condition, you can administer it to them at home, you can administer it to them at school. You will not have that.
What's the school situation?
So your child has the right to be administered medical marijuana at school, but you as the parent, the designated caregiver, must be the one to give it to them. Like the school nurse, for instance, can't do it. Older teenagers can't take it upon themselves, and you cannot keep the medicine at school. So the parent has to be the one keeping it at home, transporting it, and administering it.
I think you made a good point I want to amplify, too, is that recreational users consume much more of a quantity
Definitely.
in a different format than medical marijuana.
Definitely.
What, besides the three conditions that we talked about with Dr. Shergill, what other kinds of diagnoses should parents look for, or what other kind of conditions should they look for that they might be able to use medical marijuana as a treatment? Right.
So we have 21 approved diagnoses overall in Pennsylvania for medical marijuana. I certainly do get kids in my practice coming in with epilepsy, irritable bowel, and autism. But I've also certified kids with PTSD, with chronic pain from conditions like juvenile rheumatoid arthritis, cancer. So it's not just limited to, we typically kind of think of autism and epilepsy, I feel like, but there are other conditions that kids can benefit from it.
What's your experience been with cannabis as opposed to some of the traditional treatments that Dr. Shergill outlined?
Right. So, I mean, like Dr. Shergill was talking about, the medications that we use with these conditions do tend to have both short-term side effects and long-term effects. I mean, Risperdal is one of the only approved treatments from mainstream medicine for autism, for instance. Tends to cause significant weight gain. It predisposes them to metabolic syndrome, which includes high cholesterol, high blood pressure, diabetes. Those kids have to be getting blood work at least every 6 months. Also predisposes boys to elevated prolactin, which causes something called gynecomastia, that is, that they grow breasts. And so there's always risks with these pharmaceuticals. With the marijuana, even though we don't have as much research as we'd like to on the long-term effects, you're not going to see those sorts of side effects.
So you do help. You do see people that are able to wean off their current pharmaceuticals? Yeah,
and I mean, I think that's one of the biggest things that I hear from parents when they come in is, am I going to be able to wean them off some of these meds or all of these meds? And I let them know, I can't tell you for sure, but it's pretty common that you are able to wean them off completely or partially. In the case of my own son, he had been on 4 milligrams of Risperdal for many, many years, and now he just takes a very small dose, like 0.25 twice a day, which eliminated the side effects for us, and we're very happy with. So,
great. So the big question that always comes up, I try to touch on this in all the podcasts we do, is what is the endocannabinoid system? And what effects does medical marijuana have on that system as far as anti-inflammatory, immune modulation, and so forth?
Right.
And I think from your perspective, how do you convince parents that this is an important thing?
Right. So I think it's important for parents to be aware of, the science and the medicine behind this. And the endocannabinoid system is kind of an amazing thing. It's a system in the body that we didn't really discover until, I think, 1994 or so. So we didn't even realize it was there. And it affects systems throughout the body. So it affects immune system, GI system, nervous system. And the really amazing thing about it is that its job is homeostasis, homeostasis being balance. So its job is to balance the body. And, because of these facts, you got two things. One, you have a medicine that can treat this huge array of conditions from autism, PTSD, to Alzheimer's, to cancer, to opioid dependence, to chronic pain, which is amazing. And then the other piece of it, because it's there to balance, it's very different from most pharmaceuticals. For instance, if you look at the treatments that we use for autoimmune conditions, we tend to suppress the immune system with long-term steroids and things like methotrexate, Rituxan, and then that leaves patients vulnerable because their immune systems are deficient. When you get the medical cannabis working on the endocannabinoid system, you can bring balance to the immune system. And so you're going to be able to calm down the parts of the immune system that are overactive without suppressing the parts that you don't want suppressed. And so that's how you find it having anti-inflammatory, immune modulating, pain relieving, antiemetic, anxiolytic, neuroprotective, all these different effects that would be hard to find in a pharmaceutical.
So that helps explain why cannabis is such a strong medicine for 3 such different kinds of conditions. That concludes part 1 of this Cannabis Conversation on medical marijuana for pediatrics, live from Solevo Wellness. Tune in again next time for part 2, when we'll hear from Solevo pharmacist Richard Greer and Annie Corbin, director of the Pediatrics program. Thanks for listening. This podcast is a production of Mindful Medicine, LLC.